SUD clinics coming to New York City Health and Hospitals, Lincoln in particular, is a continuation of that work, and I think of the innovation of what's so important in this work. Our children are one of our most precious resources, and by investing in them and their families from the start, we'll build a safer and healthier city for generations to come. I also love that this is a program where we are trying not to stigmatize New Yorkers in any way. And to come to this with an open mind and an open heart is something that I think is one of the signatures values of this administration, and why I'm so proud to be here today to have everyone talk about it. So with that, I will hand it over to, I'm not sure if it's Dr. Wilcox or Dr. Allen.
I believe it's me, correct? Thank you.
It is you, Dr. Wilcox.
Yay, thank you,
Deputy Mayor.
And thank you, Deputy Mayor Williams-Isom. I'm so honored to be here today with all of you talking about this most important topic. As Deputy Mayor said in her introduction, perinatal substance use disorder is a large and growing problem. According to the New York City report on pregnancy-associated mortality in New York City 2020, mental health conditions were the leading underlying cause of pregnancy-associated deaths. 9 of these deaths were poisonings or overdoses related to substance use disorder, and 2 were suicide deaths. Residents of the Bronx had the highest rate of unintentional overdose deaths in 2022, and 4 out of the top 5 neighborhoods with the highest rates of overdose deaths are in the Bronx. We are so pleased to join Mayor Adams' Women Forward New York City initiative with this significant investment of $8 million for a family substance use disorder clinic to be placed in the South Bronx. New York City Health and Hospitals Maternal Home, which was instituted in 2018, provides support and comprehensive wraparound services for pregnant people in need, resulting from clinical, behavioral health, or social determinants of health factors, and is one of the greatest referral sites for the citywide doula initiative. The Family Substance Use Disorder Clinic will provide clinical care, support, and comprehensive wraparound services for patients and their families related to substance use disorder. We know that there is significant trauma in families and children related to substance use disorder, and this family SUD clinic will go a long way to addressing the need for clinical care and supportive services. We also know that this family SUD clinic will continue the work toward providing equity and the best clinical care for our patients and their families. This work was started when leadership from New York City Health and Hospitals, Dr. Mitchell Katz and Dr. Michelle Allen, who you see here on this meeting today, instituted the requirement for providers to have informed written consent from patients before testing them for substance use. And this work led an effort across the entire state, followed by hospitals statewide, to institute this, and has now reached the governor for implementation. We consider substance use to be a clinical problem. It's a medical problem that needs treatment, and therefore we engage in screening patients using a standard screen to get them to care and not necessarily to test, which we know can have devastating downstream effects. So this clinic, with the significant investment, which we're so grateful for, will further the care, the equitable care that New York City Health and Hospitals gives to its patients. Thank you.
Thank you so much, Dr. Wilcox. Dr. Havens, do you want to talk more about the actual clinic?
Yes. Oh, I'm on twice.
Dr. Havens, if you mute one of them, that should.
All right, I muted one of them. It's not working. I'm sorry. Dr. Allen, maybe you could take this.
If you turn off your phone.
Can you turn
Maybe
off
if you
one of
would.
them? Yeah.
I'm trying to.
Or maybe go out and come back in.
I'll go out and come back again.
So while Dr. Havens is retooling, the focus of this service is really keeping the family together. There are other programs that actually do a fabulous job taking care of the pregnant woman. But we have to realize while she's pregnant with this particular child, very often there are siblings in the home. And our whole purpose is keeping the family together, whether it's a nuclear family or an extended family, and also realizing the partnership and the role the father, the baby plays, the male partner. Our services are will be co-located at Lincoln hospitals with substance use disorder treatment, whether it's buprenorphine or methadone or behavior modification, and access to pediatricians, behavioral health specialists, family medicine specialists, obstetricians will be provided all together. Dr. Havens is a child and adolescent psychiatrist and has been really the spearhead behind this service, having taken care of the children who have been impacted by substance use disorder. So I'll turn to Dr. Havens now to explain to us the behavioral health support for this program. Jen, can you hear us? Looks like not.
It appears she doesn't.
Let me just, Jen, can you hear us? Maybe in the chat. I'll just say, having done this work off and on over the past 40 years, when you focus on the mother and you bring in her family, pregnancy is really an ideal time for behavior modification and changing behavior. And I've worked both in the private sector as well as the public sector, and pregnant women have the same goals in mind, to have a full-term pregnancy with a healthy child and going home together. And it's been my experience, if you focus on the patient, the mother, where she is, building the trust between the provider and the family goes a very long ways, so that these women actually, in spite of all the challenges they have in life, which is childcare, employment, if the father of the baby's incarcerated, other food and nutrition, etc. In spite of all the barriers of getting health care, if you build that trust and surround them with the support, empathy, and compassion, they actually do complete their pregnancies drug-free and get to go home with the mother-child dyad.
And Dr. Allen, I think you might have said this, but as I was thinking about my work at the Children's Services and ACS, the issues around race and Black mothers in particular, and some of the biases that we have. And so when you're saying keeping the family together, I don't want anyone to hear us saying, what we're saying is safely together. And we believe that if you're giving the moms exactly what they need and you're focusing on them, you're able to really deal with some of those biases that people have when they come to see some Black and Latino moms, and make sure that they get what they need and that everyone is safe.
Exactly. Safety is the underlying word. The biases are real. If you look at the data, who gets tested, urine toxicologies, it's the women of color who get tested at a higher rate. Then if you look at the positive toxicologies, it's actually not the women of color who have the higher incidence of using substances. And in terms of safety, we actually do have social workers on site looking at the social determinants of health, looking at exposure to violence in the home. The worst thing that can happen is we keep a family together and then we have to deal with the consequences if there's violence in the home. And we actively refer patients to domestic violence shelters if that's what's needed. I think exposure to violence in raising children is one of those adverse childhood events that just has severe consequences. I don't know if Dr. Havens, if you can hear us now.
I don't know if I solved this problem. I didn't. Sorry.
You didn't solve the problem, but
You
you don't
sound
sound so
okay.
bad. Yeah, you don't sound so bad. You can keep on going.
Okay, so this program is so important in the sense that it provides a supportive, non-judgmental environment for women and their children. We know the risk of opioid relapse is so high after the delivery of a child. This will allow us to wrap the supports around a woman and her children and her family so that they can get through that very difficult period and keep their families together and have their children have opportunities to grow up in a healthy way.
May I just add some of the background of, where we're starting as New York City Health and Hospitals. So we know that we're the largest provider of behavioral health care in New York City. We provide almost 60% of behavioral health services citywide. We serve over 75,000 patients annually across our emergency departments, inpatient and outpatient care. And we currently offer a spectrum of services that will clearly just, be expanded and improved by the foundation of this family-centered practice in the South Bronx. Currently, we do have a spectrum of services that treat substance use disorders, including several outpatient clinics. We have opioid treatment programs. We have buprenorphine treatment in person or via telehealth visits. This also is an equity issue. There are research articles that are written about how buprenorphine is often not offered to Black patients or patients of color. And in addition, we always have that equity lens. And so whether it's in person or through virtual express care, which is our expansive telehealth services, we strive to address those equity issues in treating our patients. But as you've heard everyone on this call say, it's really not just about treating the pregnant person. It is about treating families in this holistic manner. We aim to have childcare. We will serve the pregnant and or postpartum person because many of these deaths occur, in the postpartum period. In fact, the majority of them occur days 43 to up to a year postpartum. So it's really important to get patients engaged in their care. The postpartum period is a very vulnerable time. And so it's not just these patients, but as you heard Dr. Allen say, and Dr. Havens and Deputy Mayor, this can be quite traumatic for the families of patients using substance use. Their children are at risk for these stressors and of their own lifelong disabilities resulting from having a parent, affected by substance abuse or substance use disorder. And so, really getting the children engaged in care and the families of these patients engaged in care will go a long way towards healing for healthy people in the future.
The
And-
only thing I wanted to add really quickly, and I don't think I said this, was that this is also supported. I think there's $8 million that we've invested in this program as part of the Woman Forward New York City. And Woman Forward New York City is not just about one type of woman in one particular neighborhood from one particular class or background or ethnicity. We talk about there's programs in there for formerly incarcerated folks, for women who are homeless. We talk about older adults. And so this particular population, women who have substance use disorder, I think that is another way of us saying that we all are on a spectrum and have a wide variety of issues that we deal with during our lifespan. And this administration really wants to look at that holistic views. We've talked about the person, we've talked about the family. This affects communities, whole communities. And so we want to make sure that we're paying attention to all of that.
And we've learned so much and made so much progress in the harm reduction world and engaging people who would otherwise not feel safe in our health services. This is really an attempt to take our health services to the next level, where we can provide a safe and therapeutic environment to women, where they can allow us to help them with the treatment of their addiction and help them help their children and their partners to go on to be as healthy as possible. And co-locating all of these services in one space at the same time is something that's starting to spread across the country. I think what's going to differentiate us is our really strong focus on all the children in the family and using this as a secondary preventive intervention for kids affected by their parents' substance use.
And we're actually learned so much from Dr. Havens about childhood development, and the idea of an integrated program where we have several disciplines. Dr. Havens was very much involved in our 3-2-1 program, which is following the child for the first 3 to 5 years of life. So we're starting while the mom's pregnant with the index pregnancy, following that child for a number of years. Dr. Havens has taught me so much about the adverse events of childhood, just those things that happen in utero in the first 3 years and the long-term consequences that they have in that child's development. It's really been an opportunity for us to learn from each other as well.
Yeah.
Sounds like the Harlem Children's Zone Baby College and beyond, right? How do you give people what they need, when they need it, in culturally appropriate environment for as long as they need it, right? Not about
Exactly.
program.
Exactly.
Thank you so much. I know I wanted to leave some time for some Q&A, whereas I think we have about 8 minutes. I know everyone's very busy. I'm going to do this in RSVP order. So I'm going to start with Maya.
Hi, can you hear me?
We can hear you.
Well, I was hoping that you could lay out a little bit more specifically how this differs from what H&H currently offers people. I mean, I know you mentioned some of the substance use services that you already have, but for the 8 million investment, are you bringing on additional clinicians, or are there different specialties that you're now going to offer?
Yes.
Also, can you talk about like the annual capacity that you're expecting?
Yeah, so what's different about this program is it's specializing in families affected by SUD and providing all of the health and behavioral health and addiction services in one environment. We don't have any program like that currently at H&H, and we frankly don't do the best job we could engaging women using drugs during pregnancy and our other services. You really need a specialized co-located space that can take care of the whole family. And that's what we're going to have here, dedicated to helping parents with substance using problems recover and also take care of their kids as effectively as they can. There's no model like this in New York City right now. And we expect when we're fully operational, which will take a bit of time, it is not easy to engage these women in treatment. They know to be wary of the healthcare system. There are always issues about child protection and family separation. So we know we will have to build up our patient population. We've learned that from other folks who run programs like this around the country. But we expect when we're fully operational, we'll have roughly 300 people in care, some of them adults, some of them kids. The other differentiating factor in this program is we treat the whole family in one place. So when you get one index adult, you usually get 2 more kids, so it increases your patient rolls. But that's what we're working towards. And we expect people will come not only from H&H, but from all over the city for this service. That has also been the experience of other providers around the country delivering these kinds of integrated services.
Thanks, Maya. Amanda.
Hi there, thanks for having this. My question is really related to the Women Forward NYC initiative and how exactly this sort of fits into some of the goals there. I know the mayor has said he wanted to reduce pregnancy-related deaths among Black women specifically by 10% in the coming years. And we know that, again, a lot of those deaths are mental health related. So I'm curious if you could lay out how exactly the city plans to reduce those deaths. What are the specific initiatives, and how does this clinic fit into that?
Deputy Mayor, do you want to answer that question or?
I think Dr. Wilcox should start because they've been doing so many great programs. And then we also have the combination of the programs that are happening at DOHMH, because it's the combination of those things that I think that she may be talking about.
Thank you, Deputy Mayor. Agreed. So this is just one program among many. You heard Deputy Mayor mention the citywide doula services earlier, as well as New York City Department of Health has the visiting nurse program and many other initiatives. You heard me talk about our New York City Health and Hospitals maternal home. That really provides maternal care coordinators and social workers to give enhanced support to patients during pregnancy when we identify specific needs. Those needs can be clinical, behavioral health, and or relate to social determinants of health needs. And so our maternal home team serves as both care navigation services, so doing referrals within New York City Health and Hospitals, as well as in our communities, referring to other services for supporting patients, and also to serve as additional points of contact. We have, within New York City Health and Hospitals, invested in a lot of technological advances to help us serve our patients better clinically. We do quantitative blood loss for all deliveries. That relates to hemorrhage, which is another leading cause of death. We have another pending program, which is a cardio-obstetrics practice, which will be located in central Brooklyn at Kings County, because we know heart disease is also a leading cause of maternal mortality. So we know that all these different programs will help work together. We know that patients who are stressed or who have other needs related to food insecurity, housing, lack of supplies for themselves or their babies, are more likely to have adverse pregnancy outcomes. And so we serve to address these needs and get patients the supplies and whatever services they need to have a healthy pregnancy, both for themselves and for their child. So all of these things will work in concert.
And I just put a note in the chat that we don't have enough time to talk about all the different things that we're doing there. So maybe we should schedule another time to talk about all, and then we'll also have our sisters from Department of Health come in and speak to us too about that.
But if Amanda, could I just address the issue of how we're going to affect mortality? We know that significant, maybe a quarter of the overdose deaths in the South Bronx are in women. And if we have a program that effectively engages them in treatment, and particularly medication-assisted treatment during pregnancy, and as I said before, can potentially support a mom if she does relapse in a safe way. And we've got a lot of experience in doing this in the 90s in the AIDS world. There are ways to protect a parent and protect a family stability with careful planning. So that's really going to hopefully keep more women healthy and keep their kids healthy.
Now we have one more minute. Nicole or Mohsin, do you have a question, a quick question? Thank you for joining all of.
So our plans is to share this with the entire community, the entire H&H community. And, as you already know, we do serve a large immigrant population here at H&H, and we're very much involved with the asylum seekers. Many of the asylum seekers come to us pregnant, and we deliver them within our four walls. And the other point I wanted to make before we ended this meeting was that while the provider sees the patient maybe 20 minutes every month, most of her care occurs, most of her environmental experience occur outside of the doctor's office. So that's why we really are focusing on, from a holistic model, not just the prenatal care. Is she gaining weight? Is the baby growing? Is the fetal heart rate reactive, et cetera? But all the other things that impact a woman's life once she leaves the office, whether it's transportation, as I said earlier, whether she has access to food, whether she needs legal services, especially if she's a new immigrant to our country, an asylum seeker, she needs legal services. We provide that at all times to all of our patients. And we do, within our four walls, over 40 or 60 different languages are spoken, and we provide interpreter services as well, either face-to-face or via other telephonic services. So, Mr. Zahir, I don't know if I answered your question, but we definitely currently take care of immigrant populations. We will continue to do that. We take care of the asylum seekers. We provide, as been said multiple times on this call, what the woman needs based on what she says she needs. We meet her where she is in her addiction journey, in her life's journey, in her journey with her partner, et cetera. We meet the woman where she needs and try our best to meet her needs.
Why don't I get you something, and I'll email you a specific answer about that. Nicole, did you have a quick question? I apologize. We're out of time.
No, I don't have questions. I just wanted to tune in.
Great. Thank you so much. Well, thank you, Deputy Mayor. Thank you, Dr. Allen, Dr. Wilcox, Dr. Havens. And thank you for Amanda and Maya and Moshin and Nicole for joining.
Don't forget to like, comment, and subscribe.